Hi everyone, and welcome to Doc's Thoughts. I'm going to share a quick patient example because I think it's really useful for all of us to hear about it. And it's a patient of mine who had shingles in the urgent care. So shingles is the reactivation of the chickenpox virus, otherwise known as varicella. It comes out as a small rash on one side of your body compared to chickenpox, which covers your whole body. Luckily we have a vaccine for this now, so a lot of our kids aren't going to be suffering from this, but shingles is something that a lot of us can get who did not have the chickenpox vaccine. And this lady, I walk in the room and I asked my normal questions. Shingles is something that's really easy to diagnose. You don't even need to touch the patient, basically. And I said, what's going on in your life? Has there been a lot of stress? Because that's usually the common trigger for shingles. And, she tells me the story. Yes, lots of stress. There's lots of turmoil at home, lots of relationship dynamics. And she ended up getting shingles because her immune system was so weakened. So what is my point of the story? The point is that when we have a lot of stress and when we don't take care of that stress and check it, we will literally weaken our bodies and we allow things that might be bad for us to come out. So shingles is just one example of this, but you have to think about things like herpes virus. People usually will get a herpes flare when their immune system is weak, which is usually because they're stressed. There are certain kinds of cancers that I think can come out if your immune system is weakened and you're stressed and those cells aren't killed off by your body. Obviously, we don't feel good when we're stressed. These are all signs that our body's not working optimally. And instead of looking at these diseases just as things we need to treat with a pill, so shingles, for example, we treat with Valtrex. But instead of looking at this concept and saying, okay, if you get shingles, treat it with Valtrex, or to not get shingles, let's just do the shingles booster or the shingles vaccine. Why don't we start to think about these illnesses as a disorder in the whole human system, and how might we fix that so these things just don't happen, period. And with that being said, this woman obviously couldn't take away the stress in her life, and that was not something that she was going to change easily. But a lot of us, I think, allow ourselves to go through periods of stress that don't need to happen. And a lot of ourselves put stress on ourselves that really isn't even there just by how we interpret the situation. So I want you to think about that. I want you to think about your immune system. I want you to think about when you are getting stressed, how you're actually weakening your body and you're making yourself more susceptible to disease. I'll think the same thing myself. And then think about how you might change things, maybe not externally, but how you process them and how you take them into your own body so that you don't develop these diseases and so you feel your best. Hope that makes sense. I'll talk to you guys soon and enjoy the rest of your day.